In this demonstration we're going to show you the Core Test brand of Ultra HCG pregnancy test strips. This is an ultra pregnancy test. That means it detects down to 10 MIU of human chorionic gonadotrophin in urine samples. Ultra tests have been available in the UK since the late 1990s. They do have the advantage of detecting a developing pregnancy 3 to 4 days before the standard 25 MIU, which is the traditional cutoff for HCG in urine, which would be a standard pregnancy test cassette or strip or midstream format. Ultra tests therefore will detect pregnancy 2 to 3 days before a standard 25 MIU test will do so. Now, some manufacturers are claiming that their test will work up to 5 days before a standard test. Many others relate this to days before the missed period, either 5 or a maximum of 7. We think this is a little misleading because in those instances, to claim those statistics, you are only detecting between 5 and 10% of pregnancies at that early stage. But what they will do is detect pregnancy earlier than the standard 25 MIU test, which will only become positive in the 24 to 48 hour period after a first positive on a 10 MIU test. Now, talk a little bit about the pros and cons of ultra pregnancy tests, because we do get asked this question a lot. A lot of people want the advantage of being able to detect and know that they're pregnant in an early stage. There is one fundamental drawback to this early testing, and that is that they have the ability to detect a small percentage of developing or implanting embryos which have placental development sufficient to excrete the 10 MIU required in urine, but then will subsequently fail to implant and fail to develop. So there will be a small percentage of pickup with these tests that subsequently do not develop into a full-term pregnancy. So it is important for all users, if they are screening with a 10 MIU ultra pregnancy test, to confirm the pregnancy has continued, that the implantation is successful by retesting with a standard 25 MIU test membrane 24, 48 or 72 hours after their first pregnancy test has been performed. Now, the Core Test brand comes in this box as shown in the video in front of you. It is a 50 test pack, so it's suitable for people going through fertility treatment or doing frequent testing. It is an in vitro diagnostic. That's what the IVD stands for self-testing. These packs are CE marked on an 0197 CE certificate. They are also FDA certified, but these being European imported packs will not show the FDA cert details on here, but it is included in the data sheet. The test foil is demonstrated here. Front foil tells you what it is. On the reverse there are simple testing instructions, so they're like a quick user's guide if you like. They do give examples of how to determine a positive and a negative test. And the foil strip, when it comes out of the packaging, is a standard blue handled dip test strip. You've got a dip end determined by the wavy lines and the maximum dip line, and you remove these from the foil just before you're ready to perform the test. And to perform the test you just take one of the test strips in a freshly collected urine sample and you dip it for between 3 and 5 seconds. And that's all you have to do, which is what I've dipped with this test. And then you will see the developing coloured dye travelling up the middle flat section of this test membrane. And then over the course of the next several minutes you will see a control line developing, and then you're looking for the presence or absence of a test line to indicate a positive test result. So what I'm going to do is just stop this video now and let this test develop, and then we'll restart when the test has shown its result. Okay, so here we are at the 5-minute stage, and I've focused in on the reverse of the Core Test foil, which gives you a very nice detailed example of how to interpret a positive test. You're basically looking for the presence of a control line with a test line, and the test line can vary from being very, very faint to as dark as or darker than the control line. Any test line present at 5 minutes in the presence of a control line indicates the presence of HCG at 10 MIU or above, and would indicate an early developing pregnancy. So if we look at the result on the test strip that we performed earlier, you can see here and compare it to the example on the foil but we've got a clear control line and the total absence of any test line. So much to my relief, I'm not pregnant, and that is a negative test result. So you can also see that the control line is really quite nice and easy to see, so the interpretation of the results is very, very simple. It really is a very simple to perform dip and read style pregnancy test. The only interpretation that you've got to draw on this is on the presence or absence of that test line, and as I say, even a very, very faint test line should be interpreted as a positive result, and the test in that case where it's not an absolute clear test line, repeat on a further sample 12 to 18 hours later, ideally 24 hours later, and what you should see in a developing pregnancy is the test line formation occurring stronger and faster in the test, so that by the time pregnancy is well established you'll see a really nice dark thick test line developing almost spontaneously with the control line. So that is the core brand of Ultra pregnancy test strips. Very easy to perform, very accurate. The accuracy on these Ultra pregnancy tests in terms of their laboratory certified function is in excess of 99% accuracy. So you can be very confident in the results that you get with these. It is important, as we've emphasised in the early part of this video, that all Ultra tests are confirmed with a standard 25 MIU test later in the pregnancy, just to confirm that the implantation is continued and that the pregnancy is developing.